I think we're going to begin.
Yeah.
First, I want to welcome everyone to our COVID-19 Q&A. I'm pretty sure most of you know me. I'm Max Topper with Physicians Health Centers, and we're, of course, your occupational medical centers in Miami. I really miss seeing you all in person and presenting in person, usually over lunch. I miss the lunches too. Today, however, we are going virtual. And with me on this Zoom are Dr. Susan Nelson, our medical director for PHC. We also have Ingrid Ponce. Ingrid is an attorney with the law firm of Stearns Weaver Miller, as well as, of course, my sidekick, Zach Rosenthal, who will handle all questions and prizes. Of course, we have a prize wheel at the end. We're known for that. So be sure to stay on so you'll be eligible to win. As your OCMED providers, we have been responding to your pressing questions throughout the summer. For the last 4 decades, PHC's main focus has been on treating work-related injuries. But now we've expanded our role, helping our employers and employees to prevent the spread of this virus. As our cities, companies, and schools are attempting to return to some form or version of normal, we want to help guide you through the science and the knowledge. Now, let's get on to our presenters. Dr. Nelson and Ingrid Ponce will please give us a short intro to yourselves, and then Zach will be sharing his screen for the Q&A questions that have been submitted and others that you may wish to add to the chat box in the Q&A section. Stay with us until the end. You may be a prize winner. And please, at the end also, we want your feedback. If there are questions or topics you want us to address, we love doing these Zoom calls because it's our only way of connecting with you right now. And it's really valuable to us to get in front of you and to keep you up on what's happening. So now I'm going to give you over to Dr. Nelson and Ingrid. Thank you so much.
Hello, I'm Susan Nelson. I'm the Medical Director of Physicians Health Center, like Maxine said. I've had almost 25 years of experience in occupational medicine. Now, as also Maxine said, we're shifting a little bit since this is the topic of the moment, COVID-19, which there is, of course, an overlap between COVID-19 and occupational medicine, but we're expanding a little bit, doing the testing, doing the antibody testing, and we'll go and we'll talk a little bit about that and about our telehealth program, which I'm very involved in, thanks to the help of Zach, my young person over here who has definitely helped an older person get into the technology of that. So thank you. So we'll be talking a lot about this today.
Ingrid?
Hi, everybody. Thank you, first of all, Maxine and Zach, for having me with you today. I love the opportunity to be able to speak to different clients and different individuals about these issues, which unfortunately have become at the forefront of what most of us are having to deal with on a daily basis. As Maxine mentioned, I'm an attorney with the law firm of Stearns Weaver. I've been practicing labor and employment for 20 years, and I've been exclusively on the management or defense side. So I represent only employers with regards to all of their employee issues that they might have. And as you might imagine, since March, COVID has been the topic of the day. So there's been a lot going on. I do have to give my one caveat, which is I know this is being recorded. As you know, today is August 19th. And unfortunately, when it comes to a lot of the information we're going to be providing, it is constantly changing. The CDC is issuing different guidances as the medicine continues to evolve. And same with the employment side of it. The Department of Labor is also constantly updating its Q&As and its frequently asked questions. So the information we will be providing is current as of today. So if you are going to have to make a decision with regards to what you should or should not do with regards to your employees, please make sure you contact your employment attorney, because we want to make sure that you're acting based on the most current information that's out there.
Perfect. Okay.
All right, so let's begin with the first question. Now, these were questions that we've been frequently asked by various clients. We do also have specific questions that were posed to us as we initiated this webinar. but we have a combination. So we kind of put it into a flow. So this is the first question where we want to begin is, what are some of the updates on COVID-19?
Okay. This is the most important, as Ms. Ponce was saying. Today, it's August 19th. This is as of today. Every day I'm subscribed to the emails for the CDC. Every day there's an update. If you look at the update every single day, there are multiple updates, but the most important update on COVID-19 is no longer the need for 2 negative tests. We've been doing some of the follow-ups for some of the municipalities, and they require they required, as it was before, 2 negative tests greater than 24 hours apart. Sometimes it would take weeks, sometimes months for them to convert to negative, but that is very normal. So the CDC is recommending 10 days from their onset of symptoms. If you are feeling better or asymptomatic in 24 hours without fever, you are able to go back to work. They have, with their research, and as time goes by, since all of this is just so new and changing not only daily but hourly, that they found that you're no longer contagious after. You may still be shedding the virus, but you're no longer contagious after those 10 days. For more severe infections, or if you're immunocompromised, it goes to 20 days. For some of the municipalities, even though it is 10 days, they're going one step further and going to the 21 days. And of course, which I will speak to a little bit before, this is the recommendations of the CDC. Of course, individual companies or individual municipalities can have their own rules. They can require the 2 negatives. They can require 1 negative. They could, decide what they want to do. But that's the main update at this point. No longer the need, which is good. There's no waiting to be tested, no waiting for the result to come back, which could come back the next day or can come back in a week. So if it's the 10 days, they're feeling better, they're able to go back to work. So that's one of the most important updates right now.
What about you, Ingrid? Did you want to contribute anything on this question?
I would say that right now we are continuing to follow the science to try to figure out what is happening with the virus. So the only significant development I would say over the last few weeks is that under the Families First Coronavirus Response Act, there were a number of regulations that were issued by the Department of Labor back in April-May timeframe that a district court in New York has ruled that aspects of it have been rendered unlawful or not valid. So as a result of that, there is a little bit of confusion right now as to some of the regulations that govern this particular law that we're going to talk about a little bit more today. And it's unclear whether that one decision has implications across the country or just limited to that one jurisdiction. So if you are an employer with fewer than 500 employees, that's the threshold under the Families First Coronavirus Response Act, you might need to do a few things differently based on some of these changes in the regulations.
And I saw Susie had a question. Hi, Susie. I haven't seen you or spoken to you in forever. But yes, I'll go into it more later. But a company can require a negative test. These are the recommendations of the CDC, that you don't have to have the 2 negative tests or 1 negative test. You can wait. You can do what's called symptom-based, not test-based. But as a company, you can require, I guess, maybe Ms. Ponce, you can go a little bit more into it. But if the company wants to, it's up to them. And if they want to require the negative test, I believe that it's their right to do that.
Correct. The only issue is if they have a note from a doctor, because some doctors are clearing individuals to return to work without the double negative test. So if they have been cleared by a doctor to return to work, then that typically will be sufficient if you can't get the second negative or the 2 negative tests.
which is something we're doing at our company. And at the end, we'll go over a little bit about our new program with PHC for medical monitoring for COVID-19 positives.
Yeah, I was just gonna say that that's what we've been doing for certain companies that have told us, yeah, we want to do symptom based, and that's what we do. We don't wait for the two negatives.
Okay, so let's move on to the next question. So can you spread COVID-19 even before you have symptoms? So Dr. Nelson, can you answer this?
Yes, and yes, you can spread COVID-19 before you have. Some people never have symptoms, and you may not even be tested, but even if you start having symptoms, about 1 to 3 days before you start having symptoms, you can spread it. So that's why the contact tracing is very important, because you'll have somebody at the job that tests positive, and then you have to go back to when they first tested positive, but you have to go at least 3 days before that to see who they were in contact with. Contact meaning, and we'll go over this more later, contact meaning which nobody should be unmasked, but within 6 feet, unmasked for longer than 15 minutes, that would be considered close contact, and that would be with the contact tracing. But yeah, you could be asymptomatic and still about 1 to 3 days before you have symptoms or tested, you can spread it. Yes.
Okay, you can go on to the next.
So what is the difference between the PCR test and the antigen test?
Okay, the PCR test is the gold standard. That is a test where the fun nasal swab, it takes, now that it depends where you go. It's all over the place. Sometimes we're getting the next day. Sometimes it's 3 to 5 days or a week. Now it's a little bit better. The antigen test is the quick test that you go to some centers and you get the result right away. Obviously, the test that actually goes to the lab and is tested in this way, the PCR test, is a lot more accurate and more sensitive and more specific. The antigen test is used when, for example, if you would have a large number of people and you need to get, I would imagine that they do that, like they started with sports. With baseball, they're testing every other day. You know, you can't wait 3 to 5 days, so they would have the they would have the quick test, but it's not as quick. I mean, it's not as accurate as the PCR test. That's the only one we do. We only do the PCR test because you have the antigen test, and you know what do you do with that? We can't be sure, so we definitely recommend the PCR test.
And these both check for an active infection of COVID-19.
They both, yeah, they're both, even though it's called PCR, it's checking for the antigen to COVID. The antigen is the active. The antibody shows if you've had the infection. The antigen is if it is active, but they're both checking for active infections.
Okay.
But yeah, the PCR is, you know, that's the gold standard.
Okay, so can I require COVID-19 viral testing, and should we be testing? So this is for the active infection.
I can handle this one. I can tell you from a legal standpoint, yes, you can. So the EEOC has taken the position that because COVID-19 poses a direct threat to not just, you know, other employees as well as customers who may be in contact with individuals, you can require viral testing as a condition of employment. So that's the easy answer. Should we be testing is obviously a very different question. And on the should we be testing, it's really going to depend on your business. It's going to depend on the type of employees and individuals you have contact with. And also, and I'll defer to Dr. Nelson on this, but one of the issues with testing, of course, is it only tests as of that one point of time. So one negative test on a Monday doesn't mean that you are going to be COVID-free on Friday. So that's obviously some of the issues with the viral testing.
Yeah, it's because you could be tested. Well, going back a little bit, if you could be, can you go back to the slide about, no, before that? Yes, before you, no, too far. the next one. Yeah. About before, if you could spread it before you have symptoms. Yes. And I think that I'm going to go into this later anyway, but the incubation period is between 2 and 14 days. So you can have been exposed to, and we've had cases of that. You can be exposed to somebody that has it. Oh, okay. I'm going to be tested tomorrow. Well, that's not going to be enough time. You have to wait the full 14 days before you're tested. And like you said, you can be tested today and be exposed tomorrow and get it tomorrow. So it's kind of, you can go back, Zach, but it's kind of a tricky thing. But that's why it's not only the testing. We have the screening forms that we do for many companies to see if they're able to be tested, if they should be tested, if you're having symptoms. Anytime you go to a doctor, they'll give you the COVID-19 form. Do you have these symptoms? So you have to look at symptoms. You have to look, most jobs will have temperature checks when you walk in if you're having any symptoms. So that, we can only do what we can.
So should we be offering antibody testing?
You want to start on this one, Dr. Nelson?
I can start on it. Not a very big, the only reason to do the antibody testing would be to see if you have the antibodies, to see if you would be able to use your plasma to help people with COVID-19 who are very sick. I think that would be its only benefit. It doesn't say if you've had an active infection. If it's negative, okay, it's negative. If it's positive, it says that you were exposed, but it does not, there is no science yet stating that you've had the antibodies that you will not get it again. There hasn't been around long enough, so we don't know. None of the, even, with any antibody for hepatitis B or anything else, it's not 100%, but at least we know, and that's been around for years and years and years. With this, we don't know. If you have the antibodies positive, you don't know if you're going to get it again. So you still have to be diligent. You still have to follow social distancing. You still need to use your mask. You need to do everything that you would be doing if it's negative or positive. So I find it kind of a useless test, but some people like to do it because, it's something, and people want to do everything they can now as far as COVID-19. But for plasma donation, I think it's an excellent idea for that. And like I said, you don't know if you have the antibodies, if you'd be able to get it again or not.
So from a legal standpoint, let me just chime in on this one before we move on. From a legal standpoint, the EEOC has issued a guidance that says you cannot require your employees to be tested for antibodies. And the reasoning is that the EEOC has basically taken the position, and I think rightfully so, that the antibody is not testing for the presence of the virus currently. It is testing for if at some point in time you may have had it. And the rationale for why the viral testing is a permissible medical test under the Americans with Disabilities Act is because of the direct threat. Having an antibody does not pose a direct threat to others or to customers who you might interact with. So because of that, the EEOC says you cannot mandate antibody testing from a legal standpoint of your employees. You certainly can offer it if that's something you wish to offer. You would have to do it exclusively on a voluntary basis, and also be mindful of whatever results are obtained are going to be considered medical records that are subject to privacy requirements under the Americans with Disabilities Act. So it's even unclear whether if you voluntarily offered the antibody testing, I don't think that you could even require your employees to tell you the results. So again, you could offer it as a benefit for many of the reasons that Dr. Nelson articulated, but you need to be very careful. You certainly cannot require it.
I have an additional question on that. Can you choose to offer the antibody testing to a certain population of your workforce and exclude others? Or would you have to make it offerable to everyone?
I would say, generally speaking, and this is just general HR guidance, it's always best to treat all of your employees in the same category and the same way. So if you're offering a benefit to some, it's ideal to offer it to all, or at least as many as makes possible sense given the scenario. I would just be very worried about some morale issues that might be perceived by some people saying, well, why do they get the testing and I do not? You know, does that mean I'm not worthy? I would be very concerned about some of those issues.
Okay, good.
Yeah, and I don't know why, like you were saying, I don't know why a company would offer that anyway, because it would not affect anything if they're positive. It has nothing to do with contagion, like the viral testing. Yeah.
So next question, is temperature checks a good idea? And what is an acceptable and unacceptable temperature range?
Okay, temperature checks are a great idea. I don't know any place that you go as far as medically wise or the gyms, the certain gyms that are open that don't have a temperature check. We had one of the questions last time because not everybody gets fever. I mean, that is you know, a good argument, but that's one of the things that we can do since we can't, you know, do the quick COVID tests on everybody, but at least it's something. And one of the things that's come up with patients, I don't know where it was placed somewhere, that the forehead temperature check, the infrared can affect the brain cells, and that's some kind of thing that's going around. Yeah, we've heard that more than once. Not true, obviously. So we've been trying to educate people on that. There's no real, as far as low temperature, there's nothing that would be acceptable as far as a low, unacceptable as a low temperature. Everyone will be in range, and anything 100.4 or above would be unacceptable. If it's under that, it's fine. If it's over that, it is not, but there's no low temperature range.
Okay.
Yeah, and from a legal standpoint, it is permissible to require temperature checks of your employees. Either they do it at home before they come to work, or they do it when they arrive at work. That is absolutely permissible under the EOC guidance. And in fact, it is recommended because it is one mechanism that you can use in addition to other tools, of course, to make sure that when you have employees returning to work, they're not possibly exposing their coworkers or customers or clients to the virus.
Oh, let me repeat that. Yeah, it is
100.4.
100.4. 100.4.
And we are doing, PHC is going on site to several companies doing temperature checks. And unfortunately, we have found people reporting to job sites with fever. So they're asked to, you know, they're not able to access the work.
Right, which may not be due to COVID-19. People have fever for other reasons now. No one thinks of other things, but except COVID-19 right now. But yeah, that would be the maximum. And not only, like Ms. Ponce was saying, not only the temperature checks, but also asking for any symptoms. If someone's obviously there coughing, you know, even though now you go anywhere, you cough, everyone's looking at you. But, you know, it goes with symptoms and also with the temperature. So at least it's one tool that we have.
Yeah, and I would just add in that in Miami-Dade County, for instance, if you run a restaurant, you're required under the ordinance to temperature check your employees before they walk in the door. So there are certain industries and certain local municipalities that have actually mandated temperature checks as well. So be on the lookout for that, because there's no current federal law mandating temperature checks, but it might be based on your specific jurisdiction.
Yeah, and Mariah is making a comment that for restaurants, it's 99.5 or over, according to Jimenez's new normal order.
That is correct for restaurants.
For restaurants, okay. Let's move on to the next question. And yes, if anyone has questions, it's probably best to put it in the Q&A because they may get lost in the comments box. So that's the best way to get them. And we do have several questions already posed, and we are going to do our best to get to all of them. If not, we will make sure to get to you after the session.
Okay, I can answer that last one real quick. The antigen test is the rapid test. That is the same thing. The antigen is the rapid test. The PCR is the test that goes to the lab, and the one that takes more time but way more accurate.
Okay, so next question, is generalized fear sufficient to prevent employees from going back to work?
The short answer is no at this point. Sorry, I know some employees are not happy to hear that, but just a generalized fear of possibly contracting the virus is not sufficient. What the courts have said and what both the EEOC has said is that you need to have some type of medical reason for not returning to work. And that is usually based on some type of pre-existing condition or other type of medical issue that you have that an employer may be required to accommodate due to the fact that the virus is so contagious and does impact certain individuals, not only based on age, but also based on medical history differently. The one thing I will warn you and be cautious about is that you should not assume that certain employees should not return to work because of either their age or their pre-existing medical condition. The EEOC has made it very clear that it is up for the employee to raise that issue with the employer, not for the employer to assume that certain employees may potentially fall under a group of protected individuals. That's considered the regarded as disabled category. We want to stay away from that as much as you possibly can. I actually had a call where a client had an individual who was older, who was undergoing cancer treatment and was insisting on returning to work, even though the COVID pandemic continues. And they were fearful. They said, we're concerned that, he potentially could get the virus and could get really sick and potentially die. And what I had to explain to them is I said, listen, we need to do the interactive process to make sure that we understand, is he a direct threat to himself? But generally speaking, that standard is very, very high. So if you have an employee who is choosing to put themselves out there, you might need to accommodate them. So don't assume that anyone 65 and older can't come back to work. That's the easiest way of getting yourself into trouble.
Okay, and going on that a little bit, if a patient, if an employee is going back to work and they see, this is if everything is put into place and the social distancing and the mask, and if the employee sees that that is not being followed, then they have to talk to their employer. They have to talk to HR and say, this is not this. I don't feel safe. In that case, that would be a real fear. And because they have to go by these guidelines. If they really, if they do have it, and the fear, it's real. And if they're able to work from home for their job, if they can request that if they want to work from home, and that's fine. But as long as everything is being followed, which it generally is, sometimes we have to tell our patients, lift up your mask. It's supposed to, not be a necktie. It's supposed to go over your face and nose, your mouth and nose. But for the most part, that's been followed. So that should be okay.
So what are some tips to help return our employees safely to work? I know we've covered a couple, but what are some other ones?
We encourage self-reporting. So just as Dr. Nelson indicated, your employees should not be coming to work if they're sick, and they should know that. They should know what the symptoms are, and they should not be coming to work. They should report if they've been in contact with someone who has tested positive for the virus so that you can take proactive measures. Some of the other things that you can do is look at the physical space of your work site. Are there ways that you can implement social distancing? If you have employees sharing desks, can we separate them? Can we move people apart so they can at least remain the 6 feet of distance that's necessary for social distancing? What do your policies say? What do your policies mandate with regards to masks, with regards to maybe who can eat at the lunchroom at the same time? Can we do staggered scheduling so that we're reducing the number of people that are physically in the workspace at the same time? These are all different things that really you should look at both from a physical standpoint as well as from a personnel standpoint to make sure that you are hopefully creating the safest possible work site that you can for your employees. Obviously, you want to increase your sanitation efforts. You want to make sure that touch points are being wiped down frequently. That's doorknobs, door handles, bathrooms, the buttons for the elevators, anything that gets frequent touching, you want to make sure those are being sanitized. Most office buildings that at least I've seen have all limited the number of people that can be in common areas or in elevators. Elevators are usually limited at this point to 4 people per elevator. Masks required, same with your common areas. I know at our law firm, we are currently prohibiting visitors from coming onto the premises to, again, reduce the number of people that are physically in your space. So there are certainly a number of things that you can look at to hopefully provide a workplace that is as safe as possibly can be given what we're dealing with right now.
So this is both from, it's the employees and it's the employer. You spoke a lot about the employer, the things that they need to do. That's how they can safely go back to work, following all those guidelines. And people know what they need to do, and if that's fine. If not, then they have to speak to their employer about that to make sure that those guidelines are in place. And also the employee needs to not go to work when they're sick, because we have, two ends of the spectrum. Ones that, I sneezed yesterday and I can't go to work, or ones that, we have the same thing with workers' comp. They come in, we have to sew their finger back on, but they want to return to full duty, and other ones that broke a nail and they don't want to go to work. So there's two different ends of the spectrum. But some people, they come to work when they have fever, when they're sick. They have to know, and the symptom list keeps on growing. So basically anything could be a symptom of COVID. You may just have a headache, you may just have diarrhea. That could be it. So until, or if you were in contact with someone, close contact that you live with, that has it. So you need to make your job site aware of what's going on. I'm the point person for that here, and we speak to them and say, are you able to come to work or not come back to work? So the employee has to be very diligent, and the job site is as well.
So if an employee tests positive, what should I do with my other employees?
Okay, after everyone calms down, there has to be, like I mentioned before, there has to be contact tracing. If somebody in a department that's nowhere, and of course, this is assuming that everyone is, doing what they're supposed to, staying 6 feet apart, wearing their mask, doing everything they're supposed to. There needs to be contact tracing from at least 3 days before this employee was in contact with anyone else within 6 feet for more than 15 minutes and not protected. Then they would need to be quarantined for 14 days. The office does not have to, they don't have to shut down. They may want to do some extra sanitizing. That would be something that would be recommended. And like I said, the contact tracing, who they were in direct contact with, but not just direct contact, but within the 6 feet, shouldn't be happening, but sometimes there's no choice. Unmask and for a period of time. So some jobs may offer the testing to everybody, but this would be depending on those things who needs to be tested.
And the only thing I would add in, I agree with all of that, what Dr. Nelson said. A couple things to keep in mind is, remember, there are privacy concerns with regards to positive tests. So if someone does test positive, you cannot disclose that individual by name to your other employees. That is a violation of the privacy interests under the Americans with Disabilities Act that relate to medical records. So privacy is a tremendous issue that you need to be concerned with. You also might want to think about, after you've contacted the individuals with close contact, you could also provide a general notice to your workforce explaining that someone has tested positive without obviously identifying who, and advising that anyone who had close contact has already been notified. The reason to do this is because, as Dr. Nelson said, there may be significant emotional reactions when people learn that someone in their workplace has tested positive. So to avoid some of the panic and to hopefully make people feel more comfortable, it might be a good idea to do this type of general notice. Now, with regards to shutting down, just to be mindful for those of you in Miami-Dade County, there is an ordinance that talks about what you have to do if someone tests positive within your workplace. And you do have to potentially close for the shorter of the time that's needed to test the individuals who may have had contact, and having them be cleared, as well as a deep sanitation of the facility, or 14 days after the person tested positive, assuming there is no deep sanitation. So what I know most of my clients are doing is they're opting for the shorter of the two period, which is, if you do the deep sanitation of your facility. And it doesn't need to be your entire facility, just that portion of the facility where the individual who tested positive had contact. So if you have a 5-story office building and an employee on the first floor who never went to the other floors, tested positive, you would only have to clean that area in the first floor. And if you do that, plus you take anyone who had close contact and you remove them from the work site for 14 days, you can immediately reopen. So there are certain requirements. And again, unfortunately, these requirements are very localized. So depending on where your business is located, you really need to look not just at state law, you need to actually go deeper and look at municipal law. So you need to see if you're in Broward County, the requirements might be different than if you're in Miami-Dade County.
We are getting a lot of questions, Zach. You're
Yeah,
seeing them, but we can hold off a little till we get through some more of these and then address them.
Yeah, we received an overwhelming response of questions. So we did receive a couple of questions in advance that
wait 1 sec. I just want to go back to this. We did have one of our companies and who did send some people, because one of the employees did test positive, so they would send everybody, they had send them to have testing, and then they would come to see us for fitness for duty. And then I asked them, were you in contact with that person? And they said, well, we don't know who it is. Excellent answer. Even though I saw one of the questions come up, like if that person doesn't come in for 14 days, they'll know who it is. I don't know how to really address that, but
well, they could be quarantined. They might not be positive.
Right.
So there are other explanations.
Yeah, this is true.
Okay, Zach.
question. Okay, so I know Physicians Health Center provides low risk, low exposure testing. What does that mean, Dr. Nelson?
Okay, what that means is we have a form that we give to the companies before we go out to do the testing, or if before they come in here, saying if they have any symptoms, if they were in close contact within 6 feet without any protection, and if they were in a high risk area. Well, the high risk area is Miami, so the answer to everything is yes. And if their answer no, if they don't have any symptoms and they didn't have any close contact, then we will test them. If not, then they have to go to one of the sites. Even though we do have all the personal protective equipment, it is not the same as if you're going to a site. They do it in the car. If you've seen, how they are when you go to have the testing, that's where we would recommend. And there was another question. So if they do have fever of 100.4, if they do have some of the symptoms, then we would refer to one of the sites. And you could find that on, if you're in Miami-Dade, miami-dade.gov testing sites, you can look and they have all the testing sites. But the risk as far as, immunocompromised, low exposure, not exposed to anybody with it, and no symptoms. Those are the testings that we're doing that have a very low risk of having it. But even so, with answering the questions, have had patients who are employees who are positive, and I've spoken to them. They have no symptoms. They're perfectly fine. So you never know, and they've had no fever. So this is a lot of it is all over the place as far as symptoms and that goes.
So after a positive COVID-19 test, when can I return my employees back to work?
Okay. There are two, as I had spoken before, there's symptom-based and then there's test-based. A lot of people now are going towards the symptom-based because it gets the employee back sooner. We know that they're safe because the CDC told us so. They're recommending 10 days from onset of symptoms, patient is feeling better and greater than 24 hours without fever. That is symptom-based. You may want to, like some municipalities are saying 21 days. You can decide, but it has to be at least 10 days. And the CDC has done a research on that, and there is no more contagion after that period of time. Or some are still opting for the test-based, and that would be at least the 14 days and then 2 negative tests at least at least over 24 hours apart. So that depends, or some might require one negative test. I mean, it's up to them. So the short answer would be, if you want to do the symptom based, or if you want to do the test based.
Do we want to, at this point, Zach, explain about the monitoring of the positives through telehealth, or are we having that further in?
Can I just add in real quick on Dr. Nelson's answer to this past question on the positive?
Sure.
Just to chime in, is that regardless of whether you symptom-based or test-based, you should always be requiring some note from a doctor or medical provider clearing the person to return to work. I just want to make sure that's abundantly clear, because that is, for the employer, one of the best things that the employer can do to make sure that that person was authorized and cleared to return to work.
Yeah, because that's what, and we'll get to that with the telehealth slide, since we are workers' comp and we're dealing with some of the municipalities, and they are, and I know you have a slide on that later, but they are putting it under workers' comp. So we are the ones that are saying, we are the doctor's notes saying that they're ready to go back. But in other cases, yeah, it's not just, oh, I'm here and I'm 10 days without symptoms. No, yeah, you would need a note for sure.
So I think that transitions well into the next section. Can COVID patients use telehealth? So what we quickly want to just show you is there's a new program that we are offering at Physicians Health Center, where we are providing COVID-19 medical monitoring for someone who tests positive, where we will provide telehealth visits to a patient and make sure that they're cleared and safe to go back to work. So this way you have a physician overseeing that return to work. So just quickly, I can pull it up here on the website. So this is the new section right here, just going over the medical monitoring. And we're going to be sending out an email correspondence tomorrow, just going over this new program. But here you have the pricing. You have the ability to request the visit right through our website. And we've also created a 14-day symptom tracker. So this is something new we put together. So this is something that you should have on file at your work site, so that if an employee does test positive or they start experiencing symptoms, you have a way of documenting their history of what is occurring. So here they're able to track for 14 days, what's their temperature, what symptoms are they having, what are their results. So when they do speak with our physician, they have in writing what their history has been, and it does help with that return to work process.
Okay, so telehealth, can you make it big? Oh, thank you. So telehealth and COVID-19 go together perfectly, because the patients, the employees, the patients that we see via telehealth, a lot of them are still sick or they're still positive, and obviously they don't want to come into the office. We don't want them coming into the office. So this is tailor-made for them. So we have their initial visit. We tell them when they have to come back for their follow-up visit. We get their results, and depending on the results, when they can go back to work, or depending on their symptoms, and we'll see them and we'll talk to them, and it's a perfect. It's just a perfect marriage here with using the telehealth with the COVID-19, which we're doing mainly or pretty much exclusively with workers' comp right now, and it's just a godsend.
Yeah.
But this program will be offered for both workers' comp and non-workers' comp scenarios. So depending if the employee is just having a positive and you need the clearance, or if they're maybe a first responder and they need that clearance through workers' comp, it can be done for both situations. And the authorization form, you're allowed to identify whether or not this is going to be handled through workers' comp.
And it's for workers' comp and also for fitness for duty. We have ones that aren't. We're doing it for one of our companies now that it isn't a workers' comp, but they want someone like Ms. Ponce said, a doctor, somebody to clear them. They just don't, they don't just show up. So we're doing fitness for duty to say whether they're able to go back according to the tests or the symptoms, or however they want to use it. And this particular company wants the 2 negative tests, and that's fine. So we do that via telehealth.
So do I get paid if I'm out sick with COVID-19?
Well, this is my favorite answer as a lawyer. It depends. It depends on a number of factors. As I mentioned before, there was a federal law passed shortly after the pandemic hit called the the Families First Coronavirus Response Act. And so this is the law that provides for the first time in the history of our country, paid sick leave. It provides you up to 80 hours of paid leave if you are suffering from COVID or you're having to quarantine because of COVID. But the one caveat is it only applies to employers with fewer than 500 employees, which is much smaller than most of the other employment laws that are out there. So this doesn't necessarily apply to everybody. Under the Families First Act, you do get, like I said, up to 80 hours of paid sick leave, up to $511 a day. And also, this is in addition to any paid time off or other sick leave that you might have under your own internal policies. So if you happen to have 80 hours of vacation time, you actually have an entitlement to 80 additional hours under the emergency paid sick leave portion of this act, in addition to whatever PTO you might have. And the employer cannot require you to use it concurrently, meaning at the same time. So you can't use the paid sick leave with your paid time off. It has to be in addition to. And also, an employer can't require you to first use your vacation or PTO and then use your paid sick leave. You would use your paid sick leave first. Now, this particular law that provides the paid sick leave is only in effect through the end of this calendar year. It's really unknown at this point in time what Congress is going to do, whether it's going to extend the law onto 2021 or not. I think there are just too many variables to even question or guess as to whether that might happen. But if you are an employer that has more than 500 employees, then really whether you get paid for being out is going to be dependent on your internal policies. Because as most of you may know, the Family and Medical Leave Act, which provides for going out for a serious health condition, and that's the law that existed before the pandemic hit, that is unpaid leave. So really whether you get sick or not is going to depend on the size of your employer, whether you are able to get paid sick leave under the Families First Act, and also if you have an internal benefit to your employees to provide sick leave.
So is COVID-19 covered by workers' comp?
Dr. Nelson, did you want to handle this one?
We both can cover this one. We are doing a lot of it covered by workers' comp because as far as we see a lot of first responders, it was covered by workers' comp. Do we know if they got, because as far as corrections, fire, and police, we don't know if they got it in the line of duty or in their job, but there's a good chance that they did. So I know those are being covered. As far as somebody who you work with somebody and they have COVID-19, that might be a question for you. That I am not sure, but I know as far as corrections, fire, and police, that is definitely being covered, and we've been handling a lot of those cases.
Yeah, so this is what I call the $65 million question, because, and as a caveat, I don't do workers' comp. You know, my practice, there's actually additional lawyers that specialize in workers' comp, but I happen to have a very good friend who does the workers' comp defense, and she says that at this point, they just don't know. And the primary issue is going to be the fact that it's hard to prove where you got it. That's the biggest issue with COVID, is workers' comp covers injuries sustained on the job. And that's going to be the issue for your non-first responders, which is, did the person get it at work, or did they get it when they walked into Publix to go grocery shopping, or Costco, or wherever they might have been, where they might have been exposed to others. So this is really a very vague question right now that I don't know that anyone really knows the answers to. If you have a situation, as Dr. Nelson pointed out, that let's say you had someone who did test positive, and you have a coworker who, because of the nature of the business, they work closely together, and despite your PPE and masks, someone else got it, you may want to, in an abundance of caution, contact your workers' comp carrier to put them on notice of it, because it's always better to put them on notice of it than not. But it really is unclear whether or not in the non-first responders segment, whether or not these would even be covered.
Correct.
Yeah, for the first responders, again, you don't know that they got it that way, but in those cases, you have to assume that they did. And in that case, it wouldn't go any other way. But it's difficult. It's difficult with the non first responders.
And someone had asked who pays for these medical monitoring for COVID-19, and the answer would be is if it's being covered under workers' comp, the carrier would pay, but if not, it would be up to the employer to pay for those telehealth visits.
If they choose to offer the benefit, yes.
Yeah, if they are. Okay, so now these were some questions that were given to us in advance from the audience. So here's one of them. An employee tests positive for COVID-19, they quarantine, isolate period over, and there's no further symptoms. They return to work and then claim they still have residual symptoms. Should we ask for medical clearance?
Well,
Yeah.
they should. Yeah, they should have medical clearance, and residual symptoms is kind of vague because since we're doing the symptom base with some of the companies now, some of the employees, well, I have a little bit of shortness of breath, I have a little bit of cough, so you would have to really quantify it. So I would recommend if they could possibly do a telehealth visit, phone visit, something like that, so we can really quantify what exactly it is if they decide to do that. If not, if they didn't want to do the telehealth visit with us, they need to have some type of medical clearance with their doctor. It could be something not COVID related if they were doing better. It could be COVID related because sometimes there has been, people not necessarily reinfected, but they start with symptoms again. So they definitely, like you said, short answer, yes, they would definitely have to have some type of medical clearance, and I'm sure the other employees would be very grateful for that too.
So can someone be infected more than once with the virus? If yes, how often, and are symptoms the same, mild, moderate, or severe?
Like you were saying, how many millions? $600 million question. This is one of them. Short answer, no, nobody knows. It hasn't been around long enough. We don't know. If you have the antibodies, we don't know if you can be reinfected. And yeah, so the answer is we don't know. So we can't say if the symptoms would be the same, mild, moderate, severe. So we don't, at this time, we don't know.
Do we know how long it takes for the antibodies to build in your system if you were positive?
Between 1 and 3 weeks.
1 and 3 weeks.
It takes
okay.
1 to 3 weeks to develop antibodies, but we don't know if everybody does develop antibodies. Even with something like hepatitis B, we've had people that have come in for the series of 3 vaccines. They don't convert. They'll have another series, and they just never do. But as we've seen, most people have developed the antibodies, but it takes between 1 and 3 weeks to do so. But we don't know exactly what that means yet.
So how accurate is each type of COVID-19 test? And I think we kind of addressed this already.
Yeah, the PCR is extremely accurate. The antigen, which is the same as the rapid test, not as much, and that's not something we would normally go by, especially not, if we want someone, if it's to have someone go back to work, I wouldn't rely on that test.
I think we got a couple of questions on price. So the price on the
I was going to
COVID,
go over that in a second because I think we'll pull up the website and show how we do our pricing structure for the PCR.
all righty.
So let's just quickly see if we can get through some of these last questions. What should we do if a household member of an employee tests positive for COVID-19?
Okay, if we're talking, again, we would have to get some more information. A household member, if it's your child, or it's an elderly person, or your parent that you're taking care of, how close is the contact? You would expect if it's a household member, it's going to be close contact unless you live in a gigantic mansion and you have different wings, which most of us are not that fortunate. But after you would speak with them, find out exactly what it is, then it would be something that you would have to quarantine, and again, not test in 2 days or 3 days. You would have to be quarantined for 14 days because the incubation period is from 2 to 14 days. You can test negative in 2 days, it means nothing. You would have to wait the 14 days, be tested. If you're negative, good to go. If you're positive, then that would be another thing that you would have to wait another time period. But yeah, it would depend on how close a contact, exactly what kind, because when you're home, we would assume that you're not wearing masks when you're there with your kids or your husband or wife or with your parents. You would, you would assume that. So in those cases, almost always that you would have to be quarantined for the 14 days and then be retested and then be tested.
Okay. So if an employee decided to stay home and says they're working from home, do we have to pay them 40 hours or can it be reduced?
So the short answer to that is you always have to pay your employees for all hours worked. Doesn't matter if they're working in your physical premises or working at home. If they're working, you have to pay them. Now, if we're talking about employees who are non-exempt, meaning that employees who are eligible for overtime, the only thing you're required by law to pay them is the minimum wage and overtime based on if they work more than 40 hours. So if you have an employee, let's say earning $20 an hour for working in the office, and you allow them to work from home and you want to pay them less than that to work from home, as long as you're paying at least the minimum wage, you can do it. I will tell you from an HR standpoint, you may have some morale issues because the employees will say, I'm doing the same job, I'm working the same amount, why am I getting paid less? But that would pretty much be the only circumstances in which you can do it. You can't just all of a sudden assume that the person is going to not be as efficient or not be as productive because they're working from home and cut their pay. It's very, very important that employees be paid for all their hours worked.
All right, so before we get to the prize wheel, let's just go over one other program. Just want to talk about the actual PCR testing done at Physicians Health Center. I can get this to close. So Physicians Health Center does provide on-site PCR testing. So really the focus is to come out to your work site and provide the testing for a group of employees, mostly after an exposure. So if someone at the work site tested positive and you have a group of employees that were practicing social distancing, they were wearing masks, they were within the 6 feet, but you still need to test everyone in that department, we do provide this service. So we do use the PCR test, and we work with a local lab that does provide us a very quick turnaround time. And we are seeing the results between usually 2 to 3 days, Dr. Nelson?
At the maximum.
Yes, 24, 36 hours.
So we have here on the website is the screening form. So this is the one-page form that all the employees would complete. So prior to us coming on site, all the employees would complete this form. Our physician will review the form and clear them that they are safe to do the test. And then these would be the ones that would be able to have the test performed. We do also provide a package fee schedule is the way we price it out. So there is a collection fee. So depending on the volume of tests you're doing, you'll pay the collection fee and then you pay the lab fee per the number of tests. So the lab, it's broken down here at the bottom. It's $72 for the lab fee. So if you were testing 10 people, the collection fee would be $403 and then the 72 times the 10 for the lab fee. So that's how the price would come to this at the end. So that is the majority of our testing. Now there is also the capability of doing the testing on site. Let's say you have just 1 or 2 tests. You would follow the same process. You would reach out to your account representative, one of the 3 of us, and you would be able to submit the forms to us. We'll get the clearance, and then the office will schedule a time for that patient to come in to do the COVID-19 PCR test. Now the cost for that is $100 per test. And we are going to be sending out an email, it should be going out tomorrow, which reviews this full program. So you'll have all the links in there. And if you need to have it as a resource for the future, you'll have all the details in that email. So we did receive several questions. Now we're pretty much at the end of our hour. And I think there's probably at least 40 questions that we've just received. And I don't think we're going to be able to get to all 40 of those questions. And a lot of them are really good questions, and I want to get to them, but I'm not sure how we would go forward with this, because I can make note of all these questions, and we could plan to maybe put out a correspondence with the answers to some of these in writing, or reach out individually to the people asking these questions. It may be the best, because I don't believe we have the time to really get to all of them. And I'm sure we're going to plan to do another one of these Q&A webinars.
I would say we're going to do a minimum of one a month because the questions are coming in daily and we need to address that.
Because every day every day
Things
it's
are
changing.
changing.
It's changing
Things are
every
changing.
single day, and during the day it's changing. Yeah.
Absolutely. So we have two prizes today. We have Ingrid Ponce has been nice enough to give us from Stearns Weaver a $50 Amazon card, which arrived in my mailbox this morning, and I was sure it was from me personally from one of my family members, but unfortunately it's for the door prize. And then I also have, we're giving out a $50 Uber Eats certificate, which is fun. You can order lunches, a couple of lunches for yourself if you're working from home or at the office. So Zach, pill the first winner, and this will be for the Amazon gift card, $50 Amazon gift card.
What works is everyone's name who registered was put on this list here, and we're going to go ahead and spin the wheel, and one name is randomly going to be selected. Now you have to be present to win. So in the chat box, you're going to have to make a note to say, I'm here, I'm a winner, and we'll give you a minute to respond. But if you don't respond right away, we're going ahead and picking another person. And if that other person responds quicker, we're going to have to give the prize to them. So be ready in that chat box. If you see your name, be ready to say, I'm a winner, so you can get that prize. So here we go for the $50 Amazon gift card from Ingrid at Stearns Weaver Miller. Let's spin the wheel. Jennifer, are you here?
Jennifer who?
She's here.
Jennifer.
Yay.
Oh, yay.
From Downright.
From Downright Engineering.
Are we sure it's a different last name? We just got to make sure.
Oh, Jennifer Hyro.
Is there another Jennifer? Okay, so it maybe just be how you had registered, but okay, so Jennifer, you are the winner. Congratulations. Okay, perfect. Oh, wait, no, she's saying she's Jennifer or Copeland. Oh, so no, this could be a different Jennifer.
Okay, Zach, it's on you. Let's
All right,
move.
I think we're gonna have to spin it one more time because there was more than one Jennifer that registered. I apologize.
Okay.
Okay, so we're gonna, let me just check the chat one more time. She's with Miami-Dade. Okay, so unfortunately you have to be present to win. So we're gonna be moving on to the next name. Okay, here we go. Okay, Jacqueline. Are you here?
Jacqueline Sheasley. Oh my goodness.
She's
Okay.
Here.
Congratulations,
All right,
Jacqueline.
So just Max, if you want to just write down her name, just so we have it. So we're going to be emailing you your gift card. Okay, let me know. Can I move on?
Yes.
Okay. All right. Now it's for the $50 Uber Eats gift card. Camila Garcia, are you in the room? We'll give you another 30 seconds. Okay.
No.
Another 10 seconds. If not, we're going to have to move on to the next person. Okay, we're going to spin again now. Here we go. Maria, with 4 over, are you here? Let's see.
I know she asked a lot of questions.
Yay.
Yay!
Congratulations.
Uber Eats is on its way.
Okay, Maria, congratulations. So that was the end of our prizes. Now, again, there were a lot of questions that we still needed to get to, and we're going to just see the best way to get you those answers. So we will get back to you. Look out for our correspondence, our emails. Again, we're going to be doing an email just talking about some of our new COVID-19 programs, but we will make sure to address these questions we received.
Right. I want to thank everyone, and I also want to say that we are constantly updating our website. I have this millennial Zachary who knows how to do it all. So we update our website regularly. So it's all current. And we may even put these questions on our frequently asked question column in the website. That might be a good way to address it and have you refer back to the website for all the answers. So stay in touch, guys. We're so happy to have you.
Thank you, everybody.
Thank you.
Thanks so much for having me.
Thanks for
Thank
coming.
you. Nice to see you.
Ingrid.
You're welcome. My pleasure.
Bye.
Bye, everybody.
Bye.
Bye.